Welcome to It's Your Case, presented by vetct.com. I'm Christina Meerhof, your radiologist on demand for this week. Today's example is a 12-year-old male entire German Shepherd dog with acute onset of retching and weakness. Once you have reviewed the radiographs using your systematic approach, then you're ready to watch this video. Now I will highlight the most important findings for this radiograph. So this is all we have, a single right lateral radiographic projection of the abdomen. As gas will always be located in the highest point of the stomach, we will see gas in the gastric fundus as a single, nicely delineated gas bubble in right lateral projections. This is why the right lateral projection is the projection of choice for the diagnosis of a gastric dilation volvulus. In this case, we do not see this single gas bubble in the fundus, but we see something very different. We have one part of the stomach that is dilated and located ventrally, and we see another dilated part of the stomach dorsally. These two parts are separated by a soft tissue opaque line, which is called compartmentalization. You can also call it a double bubble sign. So in this case, the fundus is located ventrally and antrum and pylorus are located dorsally. This is diagnostic for a gastric torsion. If we see this compartmentalization, we know it's a gastric torsion. We do not need to perform additional left lateral and VD projections. So what else to think about? You should always check the entire gastric wall to see if there are any signs for necrosis. Make sure you've seen all parts of the gastric wall that are available in the radiograph. There are a few mineral opaque particles in the most dependent part of the stomach, which is considered an incidental finding. You check the remaining part of the gastric wall to make sure there are no small gas inclusions or signs for a gastric rupture, because these patients will have a much worse prognosis. And for the same reasons, you check for peritoneal free gas, as this would be a sign for necrosis or rupture. You check the abdomen caudal to the diaphragm for free gas. You start ventrally and you go dorsally. There is a radiolucent line here, but it's only seen in an area where the antrum and pylorus are also superimposed, and this might be created by the superimposition of the diaphragmatic crura and some gas in the stomach. I cannot follow this gas dorsally or ventrally. And I do not have any other signs for free gas in the abdomen. Be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.